Hi, I'm Dr. Rick. Let's talk about what happens during an asthma attack. Knowing this will help you understand why asthma is treated the way it is. So first, asthma is a serious disease. Each year, asthma leads to 200,000 hospitalizations and 750,000 ER visits. 14 million days of school are missed due to asthma. Around 175 children and 3,000 adults die each year from asthma. So clearly, asthma is a big deal. If you or your child has asthma, you want to learn as much as you can about it. This will improve your awareness and lead to your best asthma health possible. Asthma is a Greek word that means panting. If you have asthma and you're panting, that's concerning. But keep in mind that asthma can look very different from person to person. Typical symptoms include coughing, wheezing, and difficulty breathing. Wheezing is this high-pitched musical sound that comes from the small airways. Sometimes you can hear it with your ear, but it's a lot easier to hear with one of these, a stethoscope. So most people with asthma feel and act fine the majority of the time, only having symptoms episodically when their asthma flares up. Now, asthma attacks can vary from mild coughing and wheezing to severe coughing and labored breathing that can become life-threatening. Children can become listless, irritable, and even have a grayish-blue color to their lips or fingers. Other signs include seeming to tire easily or lack energy, especially when trying to exercise. A persistent nighttime cough is also a sign of asthma. It's important to mention any of these symptoms to your doctor. Asthma attacks can be triggered by many things. The list includes viral infections, sinus infections, allergies, exercise, changes in the weather, stress, strong smells, or exposure to cold air or smoke from fires or cigarettes. So an asthma attack has three basic parts: bronchospasm, airway edema, and increased production of secretions. Airways have these small muscles surrounding them. Bronchospasm means sudden contraction or tightening of these muscles. So for someone with asthma, their muscles are more reactive or spasm way more than they should. This makes it feel like they're breathing through a straw. If you've never done this, try it so you can clearly see what it's like. And I can tell you, it's really not much fun. Albuterol is a quick relief medication that treats bronchospasm. It relaxes those tight airway muscles. This increases the airway size and makes it easier to breathe again. Albuterol usually works within a few minutes and can last for 4 to 6 hours. If albuterol is not lasting 4 hours, it's a good idea to call your doctor. Also, if in general you're using albuterol more than twice a week, you should review your asthma plan with your doctor. So the next issue is airway edema. This means that the lining of the airway, also known as the mucosa, is swollen or inflamed. This causes further narrowing of the tight airways. Steroids decrease inflammation pretty effectively, and this is why steroids are a standard part of asthma treatment. So for people with chronic asthma, airway edema or swelling is the primary issue. This is called persistent asthma and is treated with daily inhaled steroids. Now that brings us to the last component, increased secretions. And these are within the airways and mainly cleared by coughing. Medications really do not help with secretions. So bronchospasm, airway edema, and secretions all happen to varying degrees during asthma attacks, which can be mild, moderate, or severe. Your doctor will help determine your asthma severity. We use the terms intermittent and persistent. Intermittent implies that in between episodes, a person is really symptom-free. Persistent asthma means that you have some symptoms on a regular basis. Accurate recognition and tracking of symptoms is key. This allows a treatment plan that matches your asthma needs. It also reduces your risk for ER visits, hospitalizations, and permanent changes in lung function. Asthma can significantly affect the quality of life for people with asthma, as well as their families. Taking the time to really understand asthma well is the first step. Having reliable information is essential. I hope this has been helpful to you. As always, call your doctor's office if something is not clear, you have other questions, or you need some help. I'm Dr. Rick. Thank you for watching.